Hello, everyone, and welcome to our latest virtual event here at the University of California, Merced. My name is Ricky Hill. I'm your e-recruiter here tonight. I'm so excited to be able to welcome you to this great event. As always, we're going to hang out for just a moment here so we can allow all of our registered guests to join us and they can get settled. So while we wait, though, I would love for you to go ahead and pull out your smartphone and take a little screenshot of what you're seeing now. Go ahead and scan that QR code. And what that's going to take you to is something called the College Tour. Now, if you haven't heard of that, let me give you a little bit of background. The College Tour is a series that is featured on Amazon Prime, and we have our own episode. It's a 30-minute episode completely focused on UC Merced, our campus, but also 10 of our fantastic Bobcats. Our 10 current students who are featured will be there to share everything for their journey on how they decided to attend UC Merced, why they love attending here and becoming a Bobcat, what that journey was like for them, as well as lots of academics and clubs and organizations and what their goals are in the future. So it is a really wonderful way for you to get a sneak peek into our campus life here, meet some of our amazing students, and also get a little glance of what our campus looks like in case you haven't yet had a chance to come and take your own campus tour. So for now, we're going to pause for just another quick moment, and I will be right back with you once the rest of our guests are able to join us. Thanks. Hello, everyone. Good evening, and a big welcome to you as I sit at the University of California, Merced with another live virtual event. So again, a big welcome to you tonight. I'm so thrilled to have you here. My name is Ricky Hill, and I am the e-recruiter here at UC Merced. Before we jump into our presentation this evening, I would like to remind you about the College Tour. And if you can grab your smartphone, go ahead and scan that QR code that you see on your screen. That's going to hop you over to a very special website with a special link that will take you to your own exclusive view on YouTube of our episode of the College Tour. A bit more background on the College Tour is that it is a television series that is featured on Amazon Prime. However, this episode of ours featuring UC Merced exclusively has not yet dropped on Amazon Prime. It's still going to be a little while before it's available there. So we have set up a website with a special link for you to get over to YouTube to watch the entire 30-minute episode. Now on that show, what you're going to learn about is UC Merced, our academics, clubs and organizations, research opportunities, career exploration, but not to mention our favorite part is that you get to meet 10 of our current students. So 10 amazing Bobcats that attend UC Merced. They will be able to share their journey with you on where they started, how they ended up here, all their amazing opportunities that they've been able to take advantage of and where they plan to go in their future, not to mention what it's like living on campus, social life, clubs and orgs, where to eat, all of the fun things and all that information that you really need to know before you become a Bobcat. Like I said, they will also be able to talk with you a bit about housing, sports opportunities, and just all the fun that comes along with being a Bobcat. So make sure that you do take that opportunity. Don't miss out on your chance to see this exclusive episode even before the rest of the world. And we will make sure to go ahead and drop that link for you over into the chat box. Speaking of the chat box, make sure that you have that open as we go through this evening. We will be dropping links for you throughout the presentation, and we would love for you to go ahead and start clicking on those and bookmarking those pages for future reference. All right, now before we do dive totally into this presentation, let me give you those quick reminders again for Zoom. If you need to adjust your audio settings, you can do that in the lower left corner of the screen. If at any time you would like to adjust the size of your window, click on View Options in the upper portion of your window. Lastly, and always most importantly, we want to get to your questions live. So make sure that you click on the Q&A button, send in your questions, and we have staff behind the scenes who may be able to get to those throughout the presentation, but we also will be saving a few minutes at the end for live question and answer time. Once again, my name is Ricky Hill, the e-recruiter here. We are getting ready to kick off this great event focused tonight on pre-health advising. At this time, I would love to introduce and bring on my colleague, June.
Hi, good evening, everyone. I'm June Verano, and I'm the Director of Pre-Health Advising here at UC Merced. Welcome to this evening's webinar. Nice to have you all here. Before we continue, I'd like to also introduce my colleague, Lorena Mejia, who is one of the pre-health advisors here at UC Merced. So between the two of us, you'll be able to schedule individual meetings with us to discuss your plans for pursuing a health career, We can assist you individually. We have workshops throughout the year as well. And we do our best to provide really, I guess, one-on-one individual service and advising. Everybody has a little bit different story that you're bringing to UC Merced. And so between the two of us, we have a good background and understanding of the differences of everybody's stories. And so we'll help you to hopefully achieve that story if you want to pursue medicine, veterinary medicine, nursing, pharmacy, etc. So this evening, some of the topics we're going to cover is choosing a health profession, the selection of your major, prereq courses, extracurricular activities, the grad professional school admissions, UC Merced pre-health advising, and last, your questions and next steps. All right, so here is a list of careers. And on the left-hand side, as you can see, physician, veterinary, nurse, physician's assistant, and on the right, firefighter, teacher, counselor, minister, certified public accountant, customer service rep. What all of these careers have in common is they're helping careers. And not that I need to know your answer right now, but things to reflect on is what is so unique for you in pursuing this career as a physician, as a nurse, as a pharmacist? What is it about that career that satisfies the need to help others that a firefighter couldn't satisfy your need in helping others, or being a counselor, a minister, or teacher? These are important things to reflect on, because down the road, as you're preparing to apply to medical school or pharmacy school or whatever program it is that you want to pursue, you will need to do your best to really communicate clearly to the programs your story of how you arrived at this moment where you want to now pursue medical school or pharmacy or whatever it is. And that's something that the med schools want to try to understand, as well as the other graduate health programs. What is it about our career or this career that really satisfies that need to help others? So in terms of majors, a lot of times one of the biggest urban myths that exists is that you need to be a science major. So the science majors, as you see on the right-hand side, are the typical science majors for a lot of people who want to pursue medicine. But on the left-hand side are also the majors that you could select and still have the same chances of being accepted to a medical school, pharmacy program, nursing program, etc. The programs don't prefer one major over another. What I will say, though, is that if you choose a science major like those on the right-hand side, the likelihood of having all the prereqs for the various graduate and professional health careers will probably be part of that curriculum. On the left-hand side, if you choose to be an English major, if we had a music major at Merced, it could be a little more challenging to fit a year of biology, 2 years of chemistry, a year of physics into your academic plan. Obviously, as a science major, you'd have a stronger science background as well, and your foundations in science may be obviously a little bit stronger than if you were a psychology major or a sociology major. But overall, I've always encouraged students to pursue the major that interests them the most, that really excites them, they're passionate about, and that they're motivated to pursue. So please think about that. Don't choose it because you think a medical school or a nursing program prefers it. They don't. Really choose the major that means something that is really meaningful to you. Another thing, the terms pre-med and pre-health is not a major. They are simply terms to reflect your interest in pursuing a health career down the road. So you will not find at any college or university a major that says pre-med or pre-health. You'll just find students that say, I'm pre-med or I'm pre-health, and that just, like I said, reflects their interest in pursuing a health career. You are free to declare any major, even those that aren't listed here this evening. You might find a different major that really interests you, and you can pursue that as well. Okay, so in general, this is what it looks like in terms of your career. It's more based on medical school, but it's very similar for nursing, for pharmacy, for dental school, for vet school. You're going to graduate in 4 years with your bachelor's degree. Then after that, you go on to graduate or professional school, and that can last another 4 to 8 years. A PA program in general for your master's degree is roughly about 2 years, so it's a little bit shorter. And then after that, a residency for some programs, which can be another 3 to 5 years. And then fellowships and subspecialties. So that would be something like when you graduate from med school, for example, and you want to be an anesthesiologist. So that's a specialty, and you're going to focus on that for a few more years after your residency. Then you are a practicing professional. You are technically a physician once you graduate from medical school. You are technically a nurse once you graduate from a nursing program, or a pharmacist. But it takes some time to develop those experiences and the nuances of that profession. And that's what continuing education will be. So as you progress through your career, many health professionals participate in conferences, or maybe they go to schools to pick up some more continuing education. Because what you may have learned 20 years ago when you graduated, obviously there's going to be some updates to all that information that you learned then. So you always want to be on top of all the current information that's health related in the field that you are pursuing. Okay, so in terms of the prereq courses, they oftentimes are a little bit kind of like people. They kind of are nuanced depending on the programs and the career goals that you want to pursue. But in general, at least for med school, it's a year of biology, 2 years of chemistry, a year of physics. Math and English oftentimes are not part of prereq requirements for medical school. Why? Because they assume that you need these courses in order to receive your bachelor's degree. Now, if you wanted to pursue nursing oftentimes will add anatomy and physiology. So those classes aren't offered at many four-year colleges or universities. Well, I should say anatomy really isn't. So a lot of those nursing and PA programs that require anatomy or even physical therapy will accept anatomy at a community college. And there are some that may even accept anatomy, for example, if you take an online course. If you reach out to a nursing program that requires anatomy, they oftentimes will tell you, okay, here is an online course that we accept. So those would be questions that you want to ask. Then pharmacy, there's some slight differences with public speaking and econ that they look for. Foreign language is also, even though it's not listed here, foreign language is also a good thing to consider. Especially if you want to remain in California, there's many people that are bilingual, trilingual. So it would really help you as a health professional if you could speak another language as well. And certainly it would help your patients feel a little bit more comfortable interacting with you because you're able to speak in their language. So those would be some things to consider. But in general, these are really the STEM science courses that many of the health profession schools across the board are looking for. So in terms of experiences, what I have always encouraged students to do is maybe start off with a career informational interview. And what that is you're interviewing an individual in the career that you want to pursue. And you're asking them questions about, how did they know that this is the career that they wanted to do down the road after college? What are the challenges of the career? How do they see the career in the future? Perhaps you might want to have a family down the road. You might ask questions about what is family and work life? Is there a balance in that particular career that you have? What is it like if I'm a dentist and I want to open my own practice? What sort of business background or economics background should I have? Because not only do you obviously need to know how to work on someone's teeth, but you also, if you're going to have your own clinic, understand like how to pay people, if you have a staff that you're going to hire. So these are things that I really encourage students to consider doing. And you can always start off by just asking within your family, letting everybody know that you have an interest in pursuing medicine or dental school or pharmacy. You just never know who Uncle Bob might know. One of your relatives may easily know somebody that they could refer you to set up a career informational interview. Other ways of doing that would be by contacting a program that you're interested in applying to, and oftentimes they have a alumni office or even the admissions office where they have a list of alumni that have an interest in speaking to prospective applicants about the program and their career. Here at UC Merced, we do have a development office, and they have a list of students that are alumni from UC Merced and are in a variety of different careers and have a interest in speaking with Merced undergrads about their career path and how they arrived at that career. It's really important for you to clarify and validate your initial impressions. So hopefully you're not thinking about pursuing medicine or nursing because you watched a movie or you watched a TV show and you thought that was really exciting. What I got to remind you, that's Hollywood that is introducing some of those drama things that you see in the movie and the TV shows. So it may not always be what you see on TV. And I think that's where the career informational interviews will be helpful and truthful about the career. But how you're going to want to clarify and validate your initial impressions is a lot of times through your own volunteer experiences or paid experiences as you're maybe in a hospital setting or in a dental office or working, in a vet office. So there's going to be some professions, specifically nursing, specifically veterinary medicine, and physician's assistant physical therapy, where there will be required clinical hours. So they want to see that as an applicant, you have experiences or at least had an opportunity to observe or shadow a veterinarian or a nurse or a dentist in their office or in a clinic. And so with regards to like nursing and PA, oftentimes when you start your research and they'll have a section in their website under admissions that says 1,000 hours of clinical hours is what they're looking for. Understand that is the bare bone minimum. Successful applicants are hovering closer to 3,000-4,000 hours of clinical hours. So it's not uncommon for many students to take some time off before applying to graduate or professional school to develop those hours. So they may work as an EMT, a phlebotomist, a certified nursing assistant, scribing, these type of experiences before applying in order to reach those many hours of clinical hours that the program's looking for. Again, some of the urban myths that exist is that students may want to pursue activities based on what they think a program wants you to pursue. But I've always encouraged students, pursue the activities that interest you, that motivate you, and that you are passionate about. And stick with those activities for a longer period of time versus having 20 different things that you participated in, but you've only been there for a month. You don't really learn anything in a month. It's better to stick with something for a longer period of time. And I think what'll happen in that case is you may get an excellent letter of recommendation out of that experience. I would imagine that in the interviews. So for many of these programs that you want to pursue, part of the component of admissions is an interview. You will be interviewed by a med school, by a PA program, etc. And your answer will probably be very enthusiastic if you genuinely pursued the activity that was really meaningful for you versus participating in an activity that you thought the program wanted you to do, and you did it out of just motion as opposed to a genuine interest in that activity. So definitely pursue the activities that are really meaningful to you. So identify those and pursue them. And, just something to keep in mind, they don't always have to be just in a clinical environment. You are all thinking about pursuing a helping career. So helping careers also include tutoring, Big Brother, Big Sister programs, working with the homeless, Red Cross, migrant, immigrant populations. So these are all helping experiences. So you want to demonstrate, number one, that you have an interest in helping others. That's part of the application process in terms of demonstrating to those programs that you're a well-rounded applicant, that you're not just a fantastic student who got a straight A. In that particular case, somebody who has a straight A but hasn't really done anything outside of school will look one-dimensional to a graduate or professional program. Okay, so in terms of our pre-health advising, when you come in to meet with myself or with Lorena, we'll talk about, what it takes and what you can do to become a competitive applicant to whatever program you want to pursue. So some of the things I just mentioned this evening are some of the topics that we'll end up covering. What's your academic record look like? What are your extracurriculars looking like? Letters of recommendation are incredibly important because the programs have no idea who you are. So these letter writers are the people that, or should, know you very well and are really advocating for you and trying to confirm or convince, I should say, to the programs, this is why you need to accept this applicant, because of their leadership, because of their intelligence, because of their problem-solving skills or critical thinking skills, whatever the case may be. In addition to meeting with us individually, we do offer workshops and we have events. So for example, this year, we took a busload of students up to UC Davis for their pre-health conference. And it's one of the largest, if not the largest on the West Coast. There's roughly 3,000 or 4,000 students who attend. And so it's a great opportunity for you to not only meet with admissions officers at their table or their booth and interact with them, but they also have workshops that cover the application process, interviewing, how to become a stronger applicant. So we were able to bring about, I don't know, 40 or so students to that conference this year. And I'm hoping that we'll have the budget to do that again next year. We also took another busload of students to Stanford University this year for their pre-health conference. Same setup as Davis. The only difference is it's a little bit more intimate in the sense of there were only 500 students at that conference versus the 3,000 or 4,000 at Davis. Throughout the year, I do invite admissions representatives from a variety of health programs to come and share about their program. And then throughout the summertime or around, currently in the process of trying to set up a structure with Mercy Hospital here in Merced to see if we could figure out a pipeline for our students at Merced to volunteer at Mercy Hospital and their surrounding clinics to develop some of those clinical experiences. So that's still in the works. Hopefully, we'll have a structure together and we can start that in the fall. That was more of a recent a recent situation with Mercy Hospital that we were able to finally meet and try to develop those experiences. So how does course selection and planning work with pre-health advising and your academic advisors? So in your first year, you'll be with Bobcat advising. You'll talk to advisors in Bobcat advising. They're gonna help you and set you up with advising for the general classes that many of these programs want to see as prereqs. So your biology and chemistry, et cetera. So after your first year, when you declare your major, or if you've already declared your major, you'll be going to your different schools. So School of Natural Sciences has academic advisors, and you'll be assigned to an academic advisor there. And that's where you can talk with your academic advisor in terms of developing your academic plan. When should you take these courses? What are the prereqs for an upper division course, et cetera, et cetera. And, if you have a hold on your registration or you need an override on excess units, that is what your academic advisor can handle and will take care of. Lorena and we have a little bit more, understand the nuances and specifics and details regarding the application process to graduate in professional health schools, which the academic advisors don't always know. And so that's how we all work together on campus. One half takes care of all the academic pieces, and then the other half really goes through the motions with helping you to develop into a fantastic applicant for professional or graduate school as you're pursuing a health profession. We will assist you throughout the application process. So I think it's next week, I will be doing my workshops on applying to medical school, or really that is applicable to all graduate and health programs. Why I say applying to medical school is the principle is really the same to applying to vet school, to applying to pharmacy programs and dental programs. As you applied to UC Merced, you had a common app and you checked off where your application wanted to go to UC Berkeley, San Diego, Davis, et cetera. The same idea is the true for medical schools and pharmacy schools and dental programs. There's a primary application. The difference is you have to fill out a secondary application, which is the application for that specific program or that specific school. And like I mentioned earlier this evening, there's also an interview process. So when meeting with myself and Lorena, and as we do workshops, these are things that we'll do in terms of supporting the application process. Once you're an alumni, you can still schedule appointments to meet with us. It doesn't stop you from meeting with us after you graduate. So a lot of students after graduation is when they actually do apply to medical school or dental school. And so they'll reach out to me and ask if they could schedule an appointment. In most cases, they really want feedback on their personal statement. And so I will do that. I asked them to give me about a week or two to review it, and then I get back to them with edits. So don't feel like after graduation, that's it. you no longer have a relationship with the pre-health advising office, you can still set up appointments with us as you're going through the application process. And we'll do our best to connect you to opportunities that are available. So later on in the slideshow, I'll show you a link for the pre-health advising list serve. And so that is how I communicate to students on campus opportunities for research, for clinical, an admissions representative from a certain school will be presenting. And so that is an important way of understanding what's coming up in terms of events, as well as opportunities. We do have the Office of Medical Education on campus that is with UCSF. And so our office works closely with them. And between the two of us, we're doing our best to also develop more clinical opportunities for students. It may not always be just in Merced. We understand like one of the challenges might be transportation. Do you have a car and are you able to drive to the places that we can find a partnership with in terms of clinical opportunities or perhaps even research opportunities? But for the most part, we're trying to focus on clinical opportunities for our students. And so in terms of opportunities, at least on campus, there are a number of areas that our students go to start developing those opportunities. So there's on-campus employment through Heroes, peer educators. I think the tutoring center and the STEM tutoring is always looking for tutors. There's undergraduate research in those areas of health psychology, public health, health sciences. Some things to also consider. Students have also, if they're sitting in class and listening to their professor talk about a research that they're involved in, many students will initiate a conversation with their faculty to find out if it is possible to volunteer in their lab if it's basic science, or to help out in that clinical research that they might be involved in. So don't feel like you have to be part of a program or you have to go through a process to find research experiences. It could be as simple as speaking and meeting with a faculty member, or again, maybe even asking a relative or someone in your network who might be working in a biotech company. I've had many students in the past. They've had friends or family members who work for Genentech, for example. And during the summer breaks, they would volunteer or work or intern at Genentech. I think some of the other things to consider is the Career Center on campus. And I know they have their own listserv, which I believe is the system called Handshake. And Robert Goodman is the career counselor who works with the School of Natural Sciences. And he will send out opportunities for our students. I think for the most part, they are jobs, but from time to time, they are internships or volunteer opportunities for students as well. So the LEAD pre-health program, that's the leadership development program primarily for third and fourth year students. That's something you can look into as you go through Merced. There are roughly 30, 35 student organizations on campus that are just focused on pre-med or pre-health areas. So there is, I will at times this past year, I've presented at a few of the student organizations that have asked me to present on medical school specifically. Your paid experiences can be through community employers. So maybe many of you are from the Bay Area or Los Angeles, outside of the Central Valley. There are certainly a lot of opportunities that you could look into in your hometown or in the areas near your home during the summertime. And that's true for like community involvement as well, the service opportunities through the various nonprofits that might be near you. Those are some things that you can look into. As I said earlier, we're doing our best to try to develop those clinical opportunities in Merced so that you could have it throughout the academic year and not wait until the summertime to even do volunteering. Now with Mercy Hospital, they do have a separate website that you can submit your name to volunteer at the hospital or their surrounding clinics. But as I mentioned earlier, we're trying our best to create a structure between UC Merced and Mercy Hospital. And I think the idea, as we've talked preliminary about this, is that there'll be some requirements, really not too involved requirements, but it might be class level, it might be something else, not quite sure yet. And if you fulfill some of the basic requirements that Merced is looking for, or Mercy Hospital is looking for, I will forward your application to them. They'll reach out to you to interview you, see if you're available to volunteer on Wednesday nights from 9:30 to 11:30 p.m. in the ER. And then if things work out, they will onboard you and train you for HIPAA and other areas that require training. So when you're volunteering in a clinical setting, it's not simply showing up and volunteering. I'm here to volunteer. There are a number of trainings that you have to go through, and specifically HIPAA. So as an undergraduate student at Merced, or really at any college or university, you're covered by FERPA. So your parents could not call your advisor or your instructor and ask, what is my child receiving in that class? What's their grade, their GPA, et cetera. HIPAA covers health records, and it is very serious. And so you need to understand what HIPAA does and what it covers. It's really important to know that, and that's where you'll be trained in that area once you start volunteering. So in terms of like acceptance rate, that's really difficult for us to calculate and share with everybody. That primary application that I mentioned previously, a lot of students, or applicants, I should say, have to check a box off that they want to release their information to the pre-health advisor at their college or university. A lot of times students either forget to do that or choose not to do that. So the accuracy of calculating how many are accepted into what programs is really difficult to know. But understand this, no med school, no pharmacy school, no nursing programs prefer a student from one college or university over another. Everybody has the same chances of acceptance. You don't need to attend an Ivy League school or any other school that is always in the news to be accepted. You have the same chance as a student at UC Merced to be accepted to a top tier program in the country. So just keep that in mind. Things that you want to think about as if you're still deciding to attend UC Merced, is what is the research and community involvement opportunities for that school. I think one thing that you should really think about when it comes to this is, how are you as a student? If you are somebody who feels that you can succeed and do well in a large environment, well, sure, University of Michigan, Ohio State, UC Berkeley, UCLA, fantastic schools, but you may be a number at that school. I think what is unique right now about UC Merced, being the youngest and most recent UC campus, the environment here is a bit more different. I truly believe that there's more access to faculty and staff on campus that may not necessarily be true at larger universities. I think faculty in general, wherever you go, they genuinely want to help students achieve their goals, whether that's academic or professional. But obviously, in a larger institution, it's more challenging to have the find the time to interact with faculty because they have so many other responsibilities versus maybe in a smaller and growing community like Merced. I think there's an inclusive environment on campus that is unique perhaps to other campuses with a population of students, what I think it's roughly around 12, maybe 15,000 at most. That's still a very small campus relative to many other campuses. And I think you'll notice that when you come on campus, how I don't know how really to describe it, but it is definitely, there's truly a sense of community on campus. Um, so, think about the academic and pre-professional support. Like many other campuses, there are pre-health advising offices. You could find them in the Career Center. They might be part of a pre-professional office where if you had an interest in medicine or health, as well as business or law, you would go to that office. And here at UC Merced, we have a pre-health advising office where it's just focused on pre-health advising and nothing else. We're really doing our best to focus on the students that want to pursue this as a career. So, Merced offers these opportunities. I think what's really important as a student is that you take advantage of these opportunities. I have met a few students that didn't know some things existed on campus. So it's really important that you know the different resources on campus, whether that's tutoring to assist you in your academics, where you go to find support if you're having some challenging moments in college, where do you go to find a counselor to talk about these things, like at the health center, for example. I think because you're pursuing a health career, the idea as an undergraduate student is very similar to, the message you hear from your doctor or your dentist. Make sure you brush your teeth, make sure you eat healthy and exercise. You want to prevent things from happening until it might be too late. Well, the same idea would hold as a student. You want to come and speak with your advisors early on. Don't wait until the end where it may be really difficult for us to be able to assist you at that point in time. But reaching out to us sooner than later can be really advantageous for you. So I want to just say that, Merced is a place where I think if you are that applicant or that student who really thrives in an atmosphere where it's close-knit and you really appreciate that and prefer that environment, then that's where I think we can offer at UC Merced. So questions and next steps. This is the pre-health UC Merced website that you can go check out. Start researching the different schools and programs that are available on campus. That subscription that here under Join Us, that is the pre-health advising list serve that I mentioned to all of you previously. That is where I communicate information to students about those opportunities, about admissions, folks presenting on their programs. So definitely sign up for it. One of the projects that Lorena and I have this summer is to update the pre-health advising website. And we want to try our best to make it a little bit more interactive than it is today. I included this subscription link because I discovered, and I just haven't had time to fix it, I discovered that the link on the pre-health advising list website is broken. And so this one will allow you to sign up for it and start receiving all that information. And you can certainly follow us on social media through Facebook and Instagram as well.
All right. Well, thank you so much, Jane, for that wonderful presentation. This is the fun time at the end of all of our webinars that we'd like to go ahead and start throwing some questions out there. Before we do, though, I do want to jump ahead for just a quick moment to let everyone know, in case some other questions came up throughout this presentation. And if you'd like to actually meet us in person, guess what? We are coming to a city near you. We just kicked off our roadshow this past Sunday down south in Los Angeles, but we do still have 3 more opportunities for you to join us. So this would be a great time for you to grab your smartphone, take a quick picture of those dates and locations that are on your screen. You see one there in the South Valley coming up just now this week in a couple days on the 10th, which is Wednesday. That one will be in the South Valley, which is the city of Visalia. We will also be in Modesto, California, coming up this Friday, and also in the Bay Area on this coming Sunday, April the 14th, and that will be in the city of Santa Clara. So just as it says on the screen there, we are so happy to be able to welcome all of our newly admitted students, your families, your guest members that may want to join, and anyone really that's in your life that is supporting you throughout your academic and educational journey. So during these sessions, you will be able to hear from alumni from UC Merced, current students. You'll get to meet folks who are campus tour guides, student ambassadors. You'll also be able to get your financial aid questions answered, registrar questions answered. We will have swag tables available if you'd like to go ahead and get a jump start on your UC Merced gear, as well as meeting and talking with and hearing from panelists who include not only students and current Bobcats and alumni, but also faculty members. So you'll be able to listen and learn about a lot of different academic programs. And like I said, if any other questions have come up throughout this presentation that you are welcome to ask now, feel free, but you also have these couple of dates and locations coming up for you if you are interested in coming out and meeting us in person. We will also drop these links to you over into the chat box so you can make sure to save your spot at one of these upcoming events. All right, June, let's go ahead and hop back over to that question slide. This is also a great opportunity to grab your smartphone, take a quick picture, so that way you have all of these links and information about social media at your fingertips. So this is also a great time to do that. So we'll leave this slide up for you here for just another moment or two. All right, let's jump into some questions. The first one that I see here, students are asking, why should they select UC Merced for their pre-med program? Is there something that we offer that perhaps another school doesn't, or what types of research opportunities or hospital access will they have if they join UC Merced?
Oh, okay. I think I mentioned it during the presentation. The environment is a little bit different at UC Merced versus a larger university. So if that's something that as a student you're looking for, Merced would be a fantastic fit for you with accessibility to faculty and staff on campus that may not necessarily be true at a larger campus. Many of our faculty are involved in a variety of different research activities, whether that's basic science or clinical research. So we also have had, I think some students, I believe in the past, perhaps work with UCSF Fresno on some research projects as well, primarily clinical experience, clinical research, I should say, versus basic science. But there is UROC on campus, which is a program that many of the students apply for and participate in.
Wonderful. And now we do also have another big event. In fact, it's the biggest event that UC Merced offers in the spring season, and it is called Bobcat Day. We will make sure to talk about that here in just another moment, but we do have someone writing in and asking if the pre-health advising if you guys will have a table or have some type of presentation on Bobcat Day.
Yeah, on Bobcat Day, we will have a table. I have I plan to lead and facilitate a panel of UC Merced alumni who are currently medical students at UCSF. They'll come out on Bobcat Day and share their experiences about being an undergraduate at Merced and how it's been to be a medical student at UCSF, and specifically in their prime program, which is the program focused on the Central Valley and rural healthcare. So we'll have that. And I just want to mention quickly also, myself, I will be at the Santa Clara or Bay Area admissions event, and Lorena will be at the Modesto, the North Valley, next Friday event. So you can reach us there and talk to us in person. I'd be happy to meet you as well if you can make it.
Wonderful. Thank you so much, June, for that extra information. I will also be at the Modesto session, so I will see you there, June, as well as anyone else that happens to join us from the Bobcat community. And also, since we did just mention Bobcat Day, why not go ahead and jump right into this particular slide? Again, a great opportunity to grab your smartphone, take some pictures here. This will give you the specific date and time. So, of course, that is Saturday, April the 20th. It does start promptly at 9 a.m. and runs till 2 p.m. If you hop over to the chat box, we do have the link there for you, and you can take a look at the full day's agenda. It is a jam-packed day, and when I tell you that you will leave with your face hurting from smiling all day and having so much fun, that is no stretch of the imagination. It is one of our most favorite days of the year. We get to meet all of you and your family, and again, we encourage you to invite family members, guests, anyone that is supporting you on your academic and educational journey. You will get to see over 200 tabling events. We have performances being offered, presentations being offered by all of our schools. So School of Engineering, Natural Sciences, and Shaw, which is Social Sciences, Humanities, and Arts. So pretty much everything that you could possibly ask for will be at your fingertips. Again, also help for you with financial aid, with registrar documents, and most importantly, you can also submit your statement of intent to register, which of course that deadline is coming up on May the 15th. Of course, you don't have to wait until May 15th to submit your SIR or statement of intent to register. You can do that tonight if you'd like, or you can wait until Bobcat Day, and we can help you and help you celebrate with your family who is in attendance with you. And of course, the statement of intent to register, what that means is that you have decided that you would love to become a Bobcat, join the Bobcat family, and have UC Merced be a part of your academic future and have your diploma from us. And we will follow you along as you're an alumni and see where you land, and of course, invite you back for panels like this one. So that is an important step in letting us know that you would like to become a Bobcat and commit and start attending UC Merced in the fall. Does UC Merced have partnerships with any hospitals to guarantee that they have physical shadowing or any type of clinical experiences?
That's what we're working on with Mercy Hospital right now. And we do have other Merced nonprofits, such as the Heinz Hospice that comes to present, and they're always looking for volunteers. That might be a really interesting experience for all of you to consider as health professionals, specifically doctors. You may one day have to deliver bad news to a patient and their family or friends. And I think hospice work will really help develop that empathy and compassion and sensitivity that you need to have as a practicing health professional, regardless of what area. And so that might be something of interest. But yes, we are working specifically with Mercy Hospital right now.
Very good. And now we all know that pre-health is very competitive. So this listener is asking us what alternatives they may have if for some reason they don't make it into med school.
Yeah, you should always have a plan B and a plan C. There is a joke, but it's really not a joke that California produces the most export of medical school applicants. So if you want to remain in California, of all the UC medical schools, Stanford, Loma Linda, USC, they are averaging on the low end at least 7,000 applicants a year, up to 10,000 applications a year. So it's really important for you to consider applying when you think you are the strongest possible applicant, which might mean taking several years off before applying to a program. You really want to do it only one time. It's very time consuming, requires a lot of effort, and it's very expensive to apply to a medical school. Not so much the other programs, but there's still costs involved. So you want to really set yourself up when you're applying for only one time and hopefully be successful and get accepted at that point. But always have a plan B and plan C as well.
That is great advice. All right, let's see. So do we have any programs or pathways to dental school?
Right now, there isn't any specific pathway to dental school, but we did have UOP Dental School present this past year. We also had UCSF Dental School present this past year. I was trying to get UCLA Dental School to present on their program, was not successful, but hopefully we'll get them next year. So these presentations, admissions presentations, really allow all students to understand the nuance of that particular school, what is really uniquely different about UCLA dental program versus UCSF versus UOP. And so it will really educate you on the different areas that the variety of different programs look for in a successful applicant. And one of the things that students don't always think about or applicants is fit. Are you going to be a good fit for that program? And that is a conversation that the admissions committee can and will have about certain applicants to their program.
That is great information. And now something a bit more general. How does someone go about signing up for pre-health for that program?
Sure. There is no actual process. Just schedule an appointment with myself or Lorena, and you can do that by visiting the Pre-Health Advising website. The Bobcat advisors during your first year, they know who we are, and oftentimes will refer you to myself or Lorena for specific advising for your pursuit of a health career.
Very good. Now, as we are getting ready to close out here, I do want to mention something that is called the Bobcat Den. And now, if you all are not familiar with that, what it is a special type of social media platform. It's designed specifically for the newly admitted Bobcats who are coming in fall of 2024. And what you can do, you'll actually be able to log into that, set up your account. You'll be able to meet other new fellow Bobcats. You'll also be able to talk with student ambassadors if you have any types of questions at all similar to these or anything really across the board from housing, financial aid, any type of question that you have. If they don't have the answer, they will make sure to put you in contact with the expert who does. You can also just generally learn about anything, clubs and organizations, and anything else that may help you make your decision that you actually do want to become a UC Merced Bobcat. So be checking your emails. If you haven't seen that already, it should be coming out soon, and we will go ahead and drop something for you over there into the chat box as well, so you'll have access to take a peek there. And also, before we do close out, I do have two more things I'd like to mention here quickly. Once again, grab that smartphone, keep that handy. You can go ahead and scan these QR codes. And we have two of these events coming up. One of them you see there on the left is Discover Your Bobcat Journey. That is just for a couple of days here in April. So make sure that you take full advantage of signing up for that one. Basically, you get the benefit of coming to campus, getting a campus tour, having a meal on campus. You will be getting 2 meal vouchers per family, so you'll be able to enjoy that as well. And like I said, you'll get a campus tour, but you also get the great opportunity and both experience UC Merced that you see on the right-hand side of your screen, as well as Discover Your Bobcat Journey. You will get the chance to go and actually sit in an actual lecture at UC Merced as if you're a current Bobcat. So you will get that firsthand experience as if you are already an admitted student who is actually attending classes in the fall. So what's better than that? You can ask questions, you can sit there and just absorb everything that you're seeing. Go ahead and take a screenshot and or scan those QR codes so that you can get signed up. Experience UC Merced is very similar to the other one. The main difference is that Discover Your Bobcat Journey, you will also be assigned a student ambassador who will be taking you around campus and kind of walking you through that day that you will be here. So be sure to sign up for that and reserve your spot. Another great spot for you to grab your smartphone, scan that QR code so that you can make an appointment to speak with an admissions advisor if you have any other questions that we haven't addressed here. And also check out some of our social media platforms. So we do have all of those listed there, as well as our email address and phone number. So you can take a look, reach us anytime that you need to, and take a peek at our social media platforms. We are posting campus pictures on TikTok. We post videos. We have current Bobcats who are talking to you and answering all of your questions there as well. So a plethora of ways for you to reach out to us. And with that, I will go ahead and allow June, if you have any last words of advice tonight that you would like to leave with our audience.
Like I said, do your best not to believe in the many urban myths that exist out there about being a successful applicant to med school or nursing programs or PA programs. Come and speak with myself and or Lorena about your possible journey to these different health careers, and we'd be really happy to meet you and talk thoroughly with what you want to do down the road.
Fantastic advice. Thank you so much, June, for presenting this evening, for everyone who's been helping us out behind the scenes, and of course, our amazing audience who is always here for us. And just always remember, if it wasn't for you, we wouldn't be here. And it is our goal to answer all of your questions and hopefully welcome you one day on campus for a campus tour. One of the amazing events that we have coming up, Bobcat Day, don't forget, Saturday, April the 20th from 9 a.m. till 2 p.m. We don't want you to miss that. Check out that website so that you can get a full list of that day's agenda. And of course, we hope to see you at one of our roadshow events, the regional receptions. We've already mentioned those as well. So hopefully we get to see you very soon in person. Until next time, we also have many other virtual events. So we will see you again very soon. Thank you so much for joining us. It's always a pleasure. My name is Ricky Hill, your e-recruiter, and we will see you next time. Have a great night, everyone.